This conference will now be recorded.
So, good morning to one and all. So, today, the practical what I am discussing is about a benign lesion of the uterus. So, basically, uterus is one of the most common site for the leiomyoma. So, leiomyoma is a benign tumor of a it's a benign tumor, which is also called as a so good morning to one and all. Today I am discussing about the Fibro Adenoma. So it is basically a lesion of the benign lesion of the breast, and it is mainly composed of a biphasic component. One is of a glandular component, and it consists of glandular epithelial stromal elements of the terminal duct lobular units. So these terminal duct lobular units are the end terminals of a lactiferous duct in the breast. So basically, this is a basic structure of the breast. It consists mainly of a normal lobules. So these are the lobules of the breast. So the lobules of the breast through the ducts or the lactiferous ducts, they will open into the nipple regions. So, and there is any lesion which is arising in these around the ductular units of a normal breast, we will have the fibroadenomas. So basically, the lining of these ducts they consist of two lining of cells. One is the luminal cells, that is the innermost layer, and the outer one is the myoepithelial layer. So these two layers are seen in the ductular units of the breast. So this fibroadenoma, or else it is also called as adenofibroma, is a benign tumor of a fibrous and an epithelial element. So it is the most common benign tumor of the female breast, and this occurs most commonly in the middle age group, that is in a age group of 15 to 30 years of age. So the sites most commonly are the breast, and sometimes this fibroadenoma can also occur in the axillary regions of the breast tissue. And mostly the patient may present with a painless, firm, and freely mobile, a slow growing mass. And sometimes we can call it as a vague terms like a breast mass. And usually these are the solitary lesions, and sometimes they can be multiple and bilateral. And the most commonly are less than 3 centimeters, and sometimes in some of the conditions they can also increase to a larger size, that is more than 3 centimeters. And grossly, this typical fibroadenoma is, as already said, it is less than 3 centimeters, that is 2 to 4 centimeters in diameter. It is solitary, and there is a prominent well encapsulated capsule, and this region is a spherical or a discoid like mass. And when we do a cut section of this region, they will show a firm gray white and slightly myxoid areas with a slit-like spaces, and these slit-like spaces are formed due to the compression of the ducts. And occasionally, these multiple fibroadenomas may form a part of the fibrocystic disease. That is, a cystic degeneration is one of the changes that you can see in case of fibroadenoma. And when the cystic changes are seen in the fibroadenoma, then you can call it as fibroadenomatosis. Less commonly, a fibroadenoma may be a fairly large in size, up to 15 centimeters, and then we can call it as a giant fibroadenoma. That is, fibroadenomas more than 15 centimeters. Normally, it will be around some less than 3 centimeters, but if it is more than 15 centimeters, then we can call it as a giant fibroadenoma. And microscopically, this fibroadenoma consists of a fibrous tissue. Predominantly, there will be a fibrous tissue with the compression of the ducts. So you can have a slit-like appearance grossly. And microscopically, the arrangement between the fibrous overgrowth and ducts may produce two types of pattern. So this fibroadenoma microscopically exhibits two types of pattern. One is in the intracanalicle, that is around the in the canalicle, or pericanal, that is around the canalicular duct. And the intracanalicular pattern is one of the most common, and which comprises of a stroma, which is compressed into this stroma will compress the ducts into slit-like or cleft-like spaces, and which is lined mainly by the ductal epithelium, or may sometimes appear as a cords of epithelial elements surrounding these masses of fibrostroma. So, and the pericanalicular pattern, it is characterized by the encircling masses of fibrostroma around the patent or the dilated ducts. So, if it is around the canalicle, then we can call it as a pericanalicular patterns, and the intracanalicular is one most commonly seen in majority of the lesions. So the first one is the intracanalicular pattern image, which is, so this is all this predominant fibrous component is around, that one is called fibroadenoma. So this will compress the ducts into slit-like spaces. And whereas this is the pericanalicular pattern. So sometimes you can have the differentials like the phyllodes tumor. So phyllodes tumor is one of the differential for these intralobular stromal neoplasms, and they are composed of stromal cells and epithelial cells. So in a benign fibroadenoma, the tumor mass will have a circumscribed border and low cellularity, and mitosis is rare. Whereas in case of phyllodes tumor, the stromal cells, they will tend to outgrow the epithelial cells, which leads to resulting in a bulbous nodules of proliferation of stromal cells, and this is covered by an epithelial layer. So the characteristic phylloid-like or leaf-like growth pattern is seen in this phyllodes tumor. So in the case of fibroadenoma, you will have the low cellularity, whereas in a phyllodes tumor, we have predominant cellularity of the stromal elements, resembling a leaf-like appearance. So this is the fibroadenoma, which is having a slit-like spaces within surrounding stromal component, and This is the phyllodes lesion. It is having predominantly or comparatively more stromal element or more cellularity of the stroma and compared to this fibro adenoma. So this is a gross morphology of the fibro adenoma, which are having numerous slit-like spaces. Here also you can see here, this one. These are all the slit-like spaces, and this is a well circumscribed lesion. You can see a prominent demarcation. Around you are having a stromal component with the narrowing of the ducts, showing a slit-like appearance cross-leg. This is another lesion, also showing the same slit-like patterns with all the small leg spaces. So it is a benign encapsulated firm lesion, and on cut surface we will show predominantly a well circumscribed capsule and a grayish white lesion with a slit-like or cleft-like spaces. So once again, a quick review of the fibro adenoma. It's a benign biphasic lesion. It's a proliferation of both glandular epithelial and the stromal components of the terminal duct. Hello. This is a normal breast tissue. Someone please off your mic. Hello. Someone of you please mute your mic. All of you please mute your mics. So this is the normal globular units of the breast tissue, and this is the lesion that we are discussing in the present class, that is a fibro adenoma with a predominant stromal proliferation with compression of the ducts, showing a slit-like pattern. So it is a benign lesion of terminal duct globular units having a fibrous and epithelial elements, and it is most common benign tumor of the female breast, and most commonly it occurs in the age group of that is middle-aged around 15 to 30 years of age. And the sites most commonly seen are the breast, and sometimes can also occur in the axillary accessory breast tissue. And clinically they will have a painless, firm, freely mobile, slow growing mass is a solitary lesion or sometimes can be multiple and bilateral, and these are mostly less than 3 centimeters in size, and sometimes it can grow to more than 15 to 20 centimeters, then you can call it as a giant fibroadenoma. So broadly, these are small, solitary, well encapsulated, spherical or discoid masses, and the cut surface is a firm, grayish white lesion. Sometimes it can also show a myxoid or mucoid degeneration and may show slit-like spaces that are formed by the compression of the duct. And occasionally, these multiple fibroadenomas they form may also have a cystic change, and these lesions with a cystic change are called as fibroadenomatosis. That is, those are multiple in lesions, and less commonly, this fibroadenoma can grow up to a size more than 15 centimeter. Then you can call it as a giant fibroadenoma, as I already said. Microscopically, this fibroadenoma can have two patterns. One is an intracanalicula and the other one is the pericanalicula patterns. In intracanalicula pattern, this trauma compresses these ducts and they will appear like a slit-like clefts which are lined by a ductal epithelium, and sometimes they can also have other patterns like cord pattern surrounding these fibrous trauma, and there are also other pattern like pericanalicula pattern. In these were compressed by the surrounding stromal tissue. No. So the differentials, that is, other differential diagnosis for this fibroadenoma is the Pillard's lesion. So in this, the stromal cells they will overgrow the epithelial cells, showing a bulbous nodular appearance of proliferation of the stromal cells, which are lined by the epithelium. So these will resemble like a leaf-like pattern. Next please. So this is the fibroadenoma. Okay. This narrow slit-like spaces with the surrounding proliferation of the stromal tissue. So here you can have a cleft-like spaces in case of Pillard's lesion. The cleft-like spaces in case of Pillard's lesion. So this is a cross appearance with the circumscribed lesion, an intact capsule, and these are the slit-like spaces in case of fibroadenoma. And this is the other lesion, the same slit-like spaces in the predominant stromal proliferation of the lesion. So it is a benign and uncapsulated lesion in cut surface shows predominantly a grayish white mass with a that are a slit-like spaces. This is the specimen of giant Fibro Adenoma. This is the specimen of the giant Fibro Adenoma. So this is a brief review, a brief idea about a benign lesion which is arising from the terminal duct lobular units of the breast tissue, that is a Fibro Adenoma. With a differential diagnosis of Pillows lesion. All of you, please enter your roll numbers in the text box. Those who have attended the class, enter your roll numbers in the text box. All the 136 members, please enter your roll numbers in the text box. All of you, please enter your roll numbers. All the members, please enter your roll numbers. So this is one of the important specimens that we kept it for your practical exams with a easy diagnosis. We can diagnose easily both crossly and microscopically. First of all, you should identify the specimen. While picking one specimen for you, first of all, you should identify which specimen it is or which organ it is. Then you should go for the morphology of the or else whether it is having a normal specimen or it is having any lesion. So in that lesion, then you should look for the morphological changes of that specific lesion. That is how you approach for a specimen. That is first identification of the specimen, then the morphology of the lesion, and then you will describe about the lesion. So that is the order that will follow while describing a specimen. All of you enter your roll numbers in the text box. Till now, only 22 members have entered the roll numbers.